I would like to show you our DocIntel's vertical workflow. For healthcare, we have few vertical workflows. One of them is the patient and doctor conversation. Typically, it's called a scribe. So we have that transcript available as a part of this process. And I will show you from the DocIntel with the patient and doctor conversations what we can get and how this helps as a part of our conversations later on with the other medical informations like lab reports, summaries, and all of these things. Let me show you how it is done. So there is a verticals options in the DocIntel. When I click on new clinical visits, it takes me to a screen, right? So before we run a clinical scribe, first we have to consent. Say that if the practice or the doctor use this one, then they have to ensure that there is a consent, right? So we need to click this consent confirm for recording, right? Then we have to give a um, document name, right? Because ultimately it would gonna get stored into the Google Cloud storage as a transcript, and from clinical scribe. And when I do a clinical scribe, as a part of the process, it automatically loads. It will do the scribing and will get a summary as a part of the workflow we're gonna see now. That's what are the different contents that it produce. And at the same time, what it would do is that it would gonna save the transcript, this conversation transcript to the Google Cloud storage. So now that will become a source document. They need to do a chunking and it will do an embedding automatically. That means that the ingestion process will gonna work that I've showed you earlier. So that's the way this information is available later for the conversations, chat, hybrid retrievals, right? Semantic search and all of these things. So now that can works with along with your after visit summary. So that if you get some after visit summaries and these conversations scribe, right? When you go to the conversations in a chat later on, somebody caregiver from your family or any you as a patient wanted to take a look, right? That's whatever being discussed, whatever being prescribed, and also that clinical, say for example, administrative, the clinicians or the administrations who works on that, they can also do verify that if there is doctor prescribed anything, and based on the transcript, right? So what does it say? Right, so they can also rectify some of the errors or pen reviews based on these conversations. So it helps for all the audiences. It's not only for the patient and the clinicians, for the administrative peoples who works for the medical billings and the codings and some other purposes and review the clinical notes. It's also helpful for them. So now what you see, that's I click the scribe, and when I click the scribe, right? So it after clicking this one, you see that this is completed, right? This workflow completed. It says the clinical scribe pending approval. So there is an approval workflow. And let's see that's what it does. See, as a part of the agent workflow, it says that clinical conversation transcription agent, right? It runs. Then SOAP, note draft agents, patient-friendly summary agents, and visit follow-up checklist agents, right? And clinical scribe governance agents. Now, if you take a look at it, does a lot of evaluations. That's how it does in terms of all of these things. Then it gives you some high, medium, low, and some of the governance related stuff, right? So now there is no scribe summary yet. It did not create a summary, but it's for the draft only. We have to save these approval packets. If we save these approval packets, what happens is that these approval packets get stored over there, right? Now you see the SOAP non-draft, no draft, right? Because it's a draft packages. So that's where you see that it says that Mr. Braja presents to Dr. Rao, right? With June 11, 26 with a 3-week history of dry cough, right? And it makes a fantastic notes for you, right? So and then the what are the different contents inside that, it also does this, right? So objective, you see, that's oxygen level, heart rate, and that's whatever will be discussed. And the assessment is also, then the plan, what are the plan that has to happen, right? What are the medication that was discussed, right? What are the orders, the test that was done, right? That was also discussed. Then the patient friendly summary it creates by its own, right? So typical patient friendly summary it creates, right? During your visit with Dr. Rao on June 26, you discussed your dry cough and shortness of breath, which had been present for about 3 weeks. You also mentioned that chest tightness and mild whistling was noted during this time. See, it's like the way that the patient basically liked the summaries. It is created that kind of summaries as well. Now, what was discussed as a part of the transcript? All of these things, it breaks into a point, right? Then care team recommendation, right? Care team recommendation, in this case, the doctor, whoever, because only the doctor was involved. So that it says that treat symptoms, then use these inhalers and have to do this blood test and everything. So what happens is, as a part of the Scribe flow, it makes all the contents is a structured informations, right? Now, what are the patient questions? Sorry, I have a cough. I have the real cough actually. So it's not only the contents; it's a real problem. The question to ask next, you see that, right? Then follow up checklist. So everything and Scribe governance, everything comes as a part of the workflow. So now it's not only the scribe, from the scribe itself, the actual informations as a part of the patient's visits to the doctor, all the informations gets picked up using this agentic AI workflow. AI basically from this transcript summarize all these informations and put it into a meaningful structured way for all this information, so that later on, that's any of the persona involved as a part of this process can take these informations and further act on it, right? So, and the actual transcript is already here. So here, I already approved this one. Now, because I approved, if I go out, you see this particular document is just this one, right? You see this, consider this as a clinical document. And if you see the source of this document, that is the clinical visit transcript. It creates automatically with as a part of the JSON structures, right? It gets stored into the GCS storage. I hope now you understand that's how it is being happening. This is the name that what we mentioned, right? And it is considered this as a clinical documents, right? Now, if we wanted to summarize this document, you can summarize what is going to happen. Whatever gets stored, it is basically can summarized based on this document, right? Now, what I can do is further, because I have this transcribe, what I can do the chat only for with this document, and maybe some of my old document as well, right? But I wanted to consider only into these documents and wanted to see that's how, what does to tell me about patient's purpose of visit. I select that document and I ask some questions, right? See, so now it is ready. It says that the patient, Mr. Braja, visited Dr. Rao primarily due to dry cough and shortness of breath. That was lasted. If you wanted to look at the source, it is vectorized. So that's, it gets the database on the keyword and the semantic match, and give the LLM with the cross encoders and can then get this information back, right? So now these information can work along with any other documents, the past documents or visit summary documents, and can get the answer back. So I hope I can explain how this vertical healthcare scribe workflow working for the patients and the doctors. Thank you.